A warm welcome to today's webinar. Today is really around making sure that we're sharing good quality technical information and experiences around how 717 can be used within the Pandemic Fund results framework, how to build that into your current proposals or to adapt it to the round one proposals, and to really make sure that you have access to the information that you need to successfully use 717 within the Pandemic Fund. My name is Amanda McClelland. I'm the Senior Vice President at Resolve to Save Lives, and it's my pleasure today to moderate a panel that includes Dr. Dalia Samara from the World Bank Pandemic Fund and Tyler Proth from the 717 Alliance. We'll run through a number of key presentations, and then we'll try to make sure that we have plenty of time for questions. We have some WHO colleagues also joining us at the end in case there's any detailed outstanding questions. So with that, it's my pleasure to introduce my friend and colleague, Dr. Dalia Samara, who is the lead health specialist for the Pandemic Fund, seconded from the World Health Organization to the Pandemic Fund. She's a public health expert with 2 decades of extensive experience across diverse domains of health emergency preparedness, readiness, and response. In her previous role, Dalia was the Regional Manager of Health Emergency Preparedness and International Health Regulations at the WHO Office for the Eastern Mediterranean region. And it's my pleasure to pass over to her this morning for some details on the Pandemic Fund results framework.
Excellent. Thank you so much. And it's indeed my pleasure to be with you today. And I do believe that this is absolutely a needed exercise as countries are about to finish completion of their proposals and submitting it to the Pandemic Fund. I do have a few slides that I would like to run, and hopefully we take the questions at the end following the next presentation. So if you allow me a second to share my slides. Excellent. Thank you so much again. And colleagues, good morning, good afternoon. This is Dr. Dalia Samara. It's really my pleasure to be with you all today. As Amanda, my colleague and friend, mentioned, this is a little bit of discussion about the 717 tool, which is absolutely an amazing tool, but how this is linked with the overall Pandemic Fund results framework. And again, it's very important that we all get on the same page of understanding, and particularly that you are trying to complete submitting your proposals. I do have a couple of opening slides, but I know that people are aware now of the Pandemic Fund, why it was in place or why it was put in place, along with some added value. But just to make sure that we are all reading the same line, and particularly if some colleagues are joining us for the first time, it really has been put in place to support the low and middle income countries to build their capacities. It's very much aligned with the international health regulations. At the same time, it at the moment try also to be aligned with the pandemic agreement, which is still being negotiated with some results to appear in the coming World Health Assembly. The unique features about the Pandemic Fund is that it brings the different sectors together. It really promotes putting some domestic funding, but at the same time encourages some additional and new funding, particularly from other partners, if you want. But the most important thing is that it really promotes the multi-sectoral coordination in a way that they need to work together. One Health is one great example, but of course, beyond the One Health, how the sectors can continue to work together to build their capacities. As you all know, the overall goal of this Pandemic Fund is building the country capacities for prevention, preparedness, and response to health threats. Initially, we want to prevent them from being or becoming outbreaks or emergencies or pandemics, but God forbid, if these are escalated to become an outbreak or pandemic or emergency, the countries have the capacities to rapidly and effectively respond to that. And therefore, the priority areas looks clearly into early warning disease surveillance, laboratory capacities, but also the workforce. Important to highlight that we have cross-cutting areas related to the community engagement and the importance of utilizing civil society organizations, but also the multi-sectoral coordination and the application of One Health, and of course, making importance or making sure that gender equity and of course the broader concept of equity is being addressed in every single step of applications or measures the countries are putting in place. This is the results framework, and the way it has been put, I know that we have heard from some professionals and colleagues in different parts that it's pretty complicated and sometimes it's difficult to follow. But perhaps I'm trying here today just to explain it in a very simple way, just to have in the back of your mind that this framework, the whole idea is that, of it is that it really helps you to define the change that you're going to achieve, where you are and what is exactly that you're going to achieve. So this pathway, it includes a number of steps, but also it offers a number of tools that you can use to help you monitor your progress, but also your achievements as you are moving with your proposals and of course, implementation upon their acceptance. Of course, it will really help you to articulate your proposal because it makes you select specific targets, but also in the monitoring and evaluation, how those targets will be measured in order to actually indicate whether you have been progressing or not. One good news is that we learn by doing, and we did receive a number of questions and concerns. So just to make sure that we are all understanding that that was the first draft we are using at the moment. We have used it for the first round of proposals, and at the moment it's the same for the second round of proposals, but at the same time we are going through an intensive series of discussions and meetings with the different stakeholders in order to improve on this result framework and to address the gaps that came before. There are 4 important areas that I will take you through them, but definitely not in details. The most important part of this talk today is really to highlight to you the tools that can be used, but also how the 717 is an important tool and very much linked with this result framework. So the 4 important elements looks into building capacities, make sure that you are establishing your capacities, but also how those capacities are ready for the response. And of course, looking into the finance aspect, whether you are able to bring sectors together and put domestic finances, but also how you are able to bring additional finances that will make sure that your capacities that have been built are being sustained and demonstrated to continue to function as we move on. So the first area that looks into capacities, you all know the tools. So we use the JEE, the SPAR, but also the PBS because it looks into the One Health related aspects. But at the same time, and particularly when you want to look into how the country has been functioning in relation to health threats or disease outbreaks, there are a number of tools that are being offered. Of course, the interaction and after action reviews, but it really gives you some qualitative information. The beauty of the 717 is that it gives you some quantitative figures that really catches the understanding or the attention of policymakers. It tells them exactly where you were, what did you achieve, but also how you can solve certain problems that appears to be some bottlenecks during the process of detection, information, and initiating the early response. Important to note here is that we are fully relying on the National Action Plans for Health Security, but also any other plans exist in the country that looks into health security in a broader concept. We understand that some of the countries may not have the NAPS, but of course, there might be other plans. So in order not to confine you with one type of a plan, we're looking into different plans and how those gaps that included in these plans are being addressed and how you're able to monitor progress related to them. So within the result framework, you always see this kind of graph, let me say. It looks complicated, but it's not. I mean, if you look deeply into it, it only tells you what kind of indicators that you can use when you look into surveillance, when you look into aspects related to One Health, when you look into laboratory, when you look into workforce and so on and so forth. But the point here is that it's not only that you would like to say that I would achieve this progress by the end of the proposal. The result framework, it makes you select specific indicators that you will be able to move in this line, but also how you will be able to make the change from one score to another. Yes, we have heard that it might sometimes be difficult to make the big change or the big move between one score to another, given the fact that there are a number of capabilities that need to be implemented. And this is where the other tools, whether it's the 717 or the interaction, the simulation exercise, but also the after action reviews, can bring an additional pieces of information that can show some progress, even if you will not be able to detect if there is any increase in the original scores of the JEE or the SPAR. The second part is related to fostering coordination, and this includes having platforms for coordination, making sure that we have the mechanism to bring the different sectors together. We always focus on the One Health, and which includes the health, agriculture, animal, and environment, given the fact that the majority of threats usually coming from this angle. But of course, the more that you are able to bring sectors on board is the better. And making sure that you're able to work with so many different implementing entities, but you're able to bring the civil society organizations, and particularly to address the issue of community engagement. And we know that the definition of communities is pretty different. It really depends on each country, how you are identifying your communities, where exactly, but also which are the partners that can be with you in order to reach out to those communities. And therefore, addressing this usually by looking into what exactly that you have put in your proposal, the annual reports, but also any monitoring and evaluation reports that you can be producing. The third one looks into incentivizing additional investment. So for this, we look into, of course, domestic funding, how the government or the beneficiary country is able to allocate some domestic funding to enhance the overall capacity for pandemic prevention, preparedness, and response. Of course, this can be financed, but this also can be in-kind contribution. In addition to that, it will be important to see how you will be able to bring additional finances from outside. And this really depends on your ability to bring the different implementing entities on board. And as we know, so far we have 13 identified implementing entities. This includes some technical organizations, but also some development banks. So important to bring them as much as possible, and to show how you are able to work with them together, how you are able to build on previous successes, how you are able to make sure that they will be committed to bring additional and new resources for the pandemic prevention, preparedness, and response. And this all can be measured by annual reports and the final report of the proposal. This is my last slide, which includes the fourth element, and this basically looks into administrative and operational efficiency related to the pandemic fund resources. And as you can see, there are a number of elements that they need to be addressed, but they all go with the same line of understanding. How the pandemic fund grant was dispersed for projects as a proportion of the total grant, which means that when you are submitting your proposal and when you are saying that I am requesting, for example, $20 million, out of these 20, how much the other people or the other entities will be able to bring? Let's say 5 million in total, whether this is an actual finance or a conversion of the in-kind to actual finance. And the total, that will be what we count as the leverage, the ratio between what you are asking, but also what you are putting in addition in order to have the bigger amount set for the pandemic prevention, preparedness, and response. Of course, it's time for the implementing entities to fully be committed to disperse the grant, and we use and make sure that the implementing entities are not utilizing big amount of money that will go for operational costs. I think we have already identified that 7% will be going for administrative costs, and those 7% on very restricted conditions can be increased, but this has to be fully justified. Other elements related to how the project is able to bring equity, but equity is not only addressed in one part of the proposal, how it's being tackled through the whole proposal. And of course, communities being at the center, and always have in the back of your mind, gender needs really to be addressed. I know there is one section that looks into that, but the beauty of taking this right from the beginning is that you will be able to address the gender and the community right from the beginning of your proposals. There are a number of reports that will be requested in order to identify whether you are on track or not. And this includes the reports that will be coming from the trustees, And the trustees basically is the World Bank. This is who are holding the money until a decision is made by the board on where to disperse the money to countries that have their proposals being accepted. And of course, or regional organizations, it depends on the proposals as they are coming. Of course, other type of reports can be from the implementing entities, and those can be either financial reports or technical reports. But all these reports are used to monitor progress related to this area of work. In order not to deviate the discussion from today, I think the most important part is really related to capacities. And this is why we're having the webinar today, to make sure that you understand how you can utilize the 717 in the different aspects related to the pandemic fund, and how you will be able to use it in the proper way, even if your proposal, God forbid, will not be taken. And there is a ceiling of the fund that is being put or allocated for the proposals. So in case your proposal will not be taken, you still can utilize the 717, because it's important that you use it in a systematic manner. And this will really help you to establish or build the culture that is needed. And hopefully your proposal will be when it's submitted for the future rounds, can be used, but at least you have a history that you can bring in your ability to use the different tools in the overall capacity building related to pandemic prevention, preparedness, and response. I stop here and back to you, Amanda.
Thank you so much, Dalia, for that detailed overview. And I see a number of questions coming in around the pandemic fund as a whole. As I mentioned at the very start, there was a long webinar series from WHO. We'll try to answer those general pandemic fund questions towards the end. But today we're really focusing on that part of the results framework, how to use 717 to inform your pandemic fund application, but also as an impact indicator. And as we just mentioned, even without the pandemic fund, you can use 717 to inform your country work. So with that, I'm going to ask Tyler Porth, who is the Interim Director and Principal Technical Advisor of the 717 Alliance, to join us. He oversees and coordinates the 717 Alliance's support for global adoption and use and scale of 717, as well as the alignment and collaboration with key global regional partners and initiatives. And so, Tyler, looking forward to some more details from you about how we can best use 717.
Brilliant. Thank you so much, Amanda. And thank you, Dr. Dalia, for your presentation and your remarks today. I'm just going to quickly go ahead and share my screen right here. Should be up now. So pandemic fund results framework. We've just heard from Dr. Dalia about how 717 has been integrated into the pandemic fund results framework. There are two indicators, 1B and 1C, which look at the frequency of 717 assessments taking place, as well as the percentage of health security systems capacities that are being strengthened over time. And these have been included as part of the overall element around developing and documenting and building capacities and capabilities. And what's exciting about this opportunity is that it creates a sort of symbiosis between the pandemic fund and the 717 target. It allows us to leverage pandemic fund resources to be able to support 717 adoption, integration, and use. And by doing so, that allows us to use 717 and the 717 target to ensure that we're achieving impact and documenting that impact through the pandemic fund investments. But as is often the case, new and exciting opportunities such as these often come with questions. So as we began fielding questions from countries around this opportunity, the 717 Alliance developed the technical brief that was attached to the webinar invitation, and we've pulled together this webinar to try to answer some of these critical questions, to link countries to other country insights and available resources that we have, and also just to generally open a line of communication to a broader range of countries so that we can continue to partner and provide support throughout the process as needed. But I want to take 5 minutes at the beginning of this just to kind of remind us all what 717 is so that we can understand how it is relevant in the pandemic fund proposal context. The reason 717 has proven to be such a useful approach for system strengthening is because it's based on this idea that every public health event is an opportunity to learn and improve. So this cycle that you'll see on the right of this slide illustrates a continuous process with continuous feedback. And that can provide us with insights into how systems are performing and also how we can improve and refine those systems in real time. So these systems should not only monitor for outbreaks and alert us to potential public health events and support the coordination and management of outbreak response, but also with every event, we should be able to assess and document the performance throughout this cycle and document that against simple metrics that allow us to make immediate improvements and also to prioritize longer term investments. This cycle is the essence of the 717 target. So the 717 target refers to those simple metrics that can be used to drive this performance improvement process. It's 7 days to detect an outbreak, 1 day to notify the appropriate public health authorities, and 7 days to complete an initial set of early response activities. Now, ideally, we would want to see as many outbreaks as possible achieve that full 717 target, but we know that often this is not the case. And where we do find those constraints in each of these individual metrics, it provides us an opportunity to improve our system's performance. So this diagram here shows the basic steps of a 717 assessment. Along the left, you'll see those primary steps. The first one is to capture and assess your 717 performance. So did we meet the full target? And if not, in which of these intervals did our system fall a bit short? The second step is using that 717 performance to identify bottlenecks and enablers. And then finally, we identify and prioritize actions to address those bottlenecks that were identified in the previous step. Now, our experience working with countries to date has shown us that this process helps us to identify both immediate actions. Those can be addressed in the short term and usually with very minimal resources, as well as identifying medium to longer term actions. And for these, it's critical that those can be prioritized in planning and funding opportunities, such as NAPS and the Pandemic Fund. So to further illustrate how this works, I think it's helpful to see a country example. So here we have Uganda. Uganda was one of the first 717 pilot countries and began implementing 717 in early 2022. So when the Sudan Ebola virus outbreak occurred in August of that year, they didn't have to wait until the outbreak was over to start to see how the system was performing. During the outbreak, key stakeholders in Uganda assessed their performance using the 717 target and found delays on both detection, which had taken 46 days, and response, which had taken 9. So the teams convened and were able to identify bottlenecks and enablers, and they were able to agree on key actions to improve the system's performance during the ongoing outbreak. So in this particular case, 2 immediate actions were identified. They identified the need for better facilities for an isolation unit and were able to identify those facilities, and also identified partners with accessible funds to support contact tracing. They also identified a critical need for nationwide IDSR training at private facilities as a longer-term priority and linked that to national planning processes. So while the 717 target is relatively new, adoption and use has been going on in over a dozen countries, and that has given us some sort of macro insights on the core principles and good practices that are important for effective implementation of 717. And I think these are important to keep in mind as we think through our planning around 717 and the Pandemic Fund. So first, 717 is a continuous performance improvement approach. It works better that way as opposed to just being a one-off assessment. Each interval of the 717 target is essential. The flexibility of 717 approach allows it to be integrated into existing systems, workflows, plans, and frameworks, as opposed to remaining a parallel tool and effort. 717 is most effective when the assessments are honest, transparent, and non-punitive. The earlier and more frequently 717 is used, the greater the impact. And finally, it is critical to engage a broad set of stakeholders to address the wide range of system-level bottlenecks that can be identified. So with all that in mind, I would like to sort of now refocus the discussion today on this specific opportunity, which is the Pandemic Fund, and dive a bit more into how we can use 717 to improve health security in Pandemic Fund proposals, considerations when we're applying, some step-by-step guidance for effective implementation, as well as budget considerations. For this, it's important to understand there are different ways 717 has proven to be a useful approach, and each of these is relevant for the Pandemic Fund. First, performance improvement. The 717 target can be used for routine identification of system bottlenecks and enablers. You can link this to priority actions, and this can drive rapid improvement. This means that constant feedback on the system can yield actions that can be implemented through Pandemic Fund plans. Second, data on real-world system performance improves our prioritization of actions and informs needed financing, including linking them to Pandemic Fund proposals and plans. In this way, as Dalia outlined, 717 is really critical and quite complementary with other tools such as JEE, SPAR, and others. On accountability and reporting, evaluating system performance against simple metrics simplifies our monitoring and improves transparency and supports accountability. Critically, this also makes it easier for us to demonstrate the impact of our investments, including Pandemic Fund. And finally, clear data based on simple metrics allows easier and more effective communication and advocacy for political leaders, donors, and other key stakeholders. So when applying for the Pandemic Fund or developing our country plans, it's important to consider the following. First, remembering the core principles from a previous slide. Those are based on our best practice from experienced countries. And I think specifically focusing on the two, that 717 is best applied as a part of everyday workflows, and the routine use of 717 yields better insights and greater impact. It's also worth noting that 717 is a relatively low-cost intervention. It does have startup costs, and I'll get to those in just a minute in the following slides. But once you get through the startup costs and the upfront costs, it's really more about sort of, there's additional but minimal maintenance and sustainability costs for the effort itself. But finally, and importantly, I really want to drive home this last point. It's critical that the 717 use of this assessment is linked to resources that can then prioritize and fund the implementation of key actions. Assessments that aren't linked to resources that enable those recommended actions to be implemented are obviously significantly less effective than those where we can actually implement the findings of our assessment. So linking the use of the target itself to resources is critical. So I'll now go through some of the step-by-step activities that are recommended to be included in our proposals and plans for the effective implementation of 717 through the Pandemic Fund. So it's important to note that these steps also correspond to our implementation toolkit, and the tools and resources to facilitate each of these steps can be found on our website, and there's a link for that at the end of the slide here. The first step is to identify a country champion. For this, we recommend selecting a high-level government official who can champion 717 during the early stages of adoption. This step doesn't really have any associated costs per se, and we typically recommend that this should happen in the first 2 months, just to identify the correct individuals and make sure that we have high-level, strong buy-in from the appropriate individuals to make sure that this can be a priority in the country. Second, identifying coordination mechanisms. So selecting a technical team to coordinate 717 implementation. And ideally, this is an existing team that already has convening power across surveillance and response stakeholders. For this activity, costs typically include some meetings to identify those coordination mechanisms, and the time frame should take place within the first 3 months of implementation. Third here, it's helpful to allocate. This isn't required per se. This is more of a recommended step, but we find that it's helpful to allocate adequate time and funding for a dedicated focal point for at least the first 6 months. The cost for this depends on if you have the existing staff, and many countries have opted to bring on a dedicated full-time position for around 6 months, just to help with the upfront startup costs and to get the process initiated. Number 4 here is around stakeholder mapping and sensitization. Identifying key individuals and organizations involved in public health surveillance and response systems. The potential cost for this is usually national and or subnational workshops, as well as engagement meetings to conduct these processes. So continuing on here, number 5. providing training for key stakeholders and technical leads on 717 concepts and methodologies. So for this, countries should budget around 3 to 4 days of training focused on 717 implementation for all key personnel. At the Alliance, we have a wide range of training materials, including a 20-hour training program intended for implementers. And so we make all of those resources available. And it also may be worth considering allocating budget for additional context-specific training as needed. Example for rapid response teams or field epidemiologists or certain specific training where there are needs for such. For number 6 here, we have adopting and modifying existing data reporting and consolidation forms to incorporate necessary indicators and metrics of the 717 target. The costs and the time frame for this, again, vary, and that will depend on the simplicity or complexity of any revisions that need to be made. But there may also be interest in including some high-value activities, such as the adaptation of existing event management systems. Number 7 is around conducting pilot initiatives to test 717 using real-world scenarios. This is important to ensure that the integration and that the buy-in and the coordination is working effectively. And for this, again, cost should be minimal, but it's really important that you're allocating adequate time across all the key stakeholders to ensure that you have alignment with country needs and processes. For number 8 here, integrating 717 target processes and workflows into existing surveillance and response frameworks, systems, platforms, and structures. This is critical. Again, we've noted that the flexibility allows it to be integrated, and we get better results when this is integrated into routine and existing workflows. The costs around this are typically minimal, and the time frame, again, varies depending on the simplicity or complexity of the integration effort. For number 9, we're incorporating 717 into our annual plans. So for this, we recommend to host a collaborative meeting at least every 6 months to review 717 assessment results, identify bottlenecks, and corrective actions. Building flexibility into national budgets and pandemic fund applications is also critical because it allows you to routinely address prioritized bottlenecks and implement short to medium term actions. Again, early evidence from 717 indicates that many of these short-term solutions can be implemented with minimal cost, but making sure that the actions that are identified are linked to flexible funding is critical to ensure that we're able to take the steps that we're recommending need to be taken. And number 10, our final step here is incorporating lessons learned, recommendations, and prioritized long-term actions into NAPS and pandemic fund processes to support long-term systems change. So here we're using 717 data for reporting and advocacy to show the impact of our investments as well. So those are the 10 key steps for starting up and adopting 717 use within the Pandemic Fund. But I want to reiterate here this opportunity where the Pandemic Fund and the 717 target really reinforce each other. The Pandemic Fund provides resources that allow us to support the sustainable adoption and use of 717. And then 717 in turn provides the framework and tools to maximize the impact of the Pandemic Fund investment and demonstrate the results of that investment. But to effectively use 717, it's obviously critical to carefully consider and budget for these appropriate steps. Again, primarily, this is startup costs. We just went through each of the activities, and there's more details in the technical brief, which will be circulated. And this provides an overview of the steps for which funds are typically required. Beyond that, it's primarily maintenance and sustainability costs, such as refresher trainings, simulation exercises, tool and resource updating. But third, it's important that we have set aside funds or link this effort to leverageable funds because the impact requires our ability to implement prioritized actions. A final note, just generally on the budget, is that costs for each of these activities will vary based on the country, the scope, the scale, existing systems capacity, and much more. So we don't want to try to be prescriptive, but we're also happy in the discussion portion of the webinar today to discuss some general costs that we're seeing in the countries that we've been supporting to adopt and use 717 through the Alliance. So finally, wrapping up here, understand that this is a lot of information and it's a critical opportunity with a quickly approaching deadline. So I just want to note that we are here to provide support along the way. The 717 Alliance is a country-led initiative with a secretariat that has been set up to provide resources and support to countries and partners that are adopting and using the 717 target, and that includes through the Pandemic Fund. The 717 Alliance provides direct technical support. We have catalytic grants for country adoption and operational research. We develop resources and host an online hub with guidance, tools, training materials, and more. And also, importantly, we connect country partners with each other. We have communities of practice and learning networks, and this allows us to share good practice and insights from leaders in countries with each other. So you'll receive these slides after the webinar. So we've included some links to some of our common resource. And I'll also just take this opportunity to plug for a website refresh that will be coming in the near future. So encourage everyone to keep an eye out for that, which will feature even more resources available to support you in 717 adoption and use. And finally, just to note that we welcome new countries to join our network and to receive additional support and guidance to join the communities of practice and more. So if you're interested in connecting, please don't hesitate to reach out to us. We have the email address here for the 717 Alliance Secretariat. And you can also subscribe here on the second link once you receive the slides to join the Global Learning Network, and that will allow you to receive the latest news and updates for all things 717. With that, I say thank you, and Amanda, I will hand it back to you.
Thank you so much, Tyler, and thank you for going through that detail. And I think, just to reiterate, there's a lot of information here. We normally run these 7-1 sessions for about 2 hours. So all of that technical content is available on the website. And as Tyler mentioned, the Alliance team is here to support you. We understand that this is a small but important component of your overall pandemic fund applications, and that those deadlines are coming up quickly. So we hope that this was useful. To get the most out of it, we're going to open up for Q&A now. And to support that Q&A, I'll ask both our panelists, Dr. Dalia and Tyler, to come back on, but also ask our WHO colleagues, Dr. Esther Hemblian, who's the unit head for the Public Health Intelligence Alert and Response Coordination unit at the World Health Organization, and her colleague, Nana, who is the Technical Officer for Strategic Planning at the World Health Organization, to join us. And we'll try to answer as many questions as we can. We understand that there's a lot of complexity around the Pandemic Fund, and we're not necessarily leading that work. So Dalia will try to answer as many questions as she can around that, but we'll try to address the 717 technical questions very specifically. But maybe I could just ask our WHO colleagues for any reflections around the webinar, the use of 717 as an implementing entity, and as the holder of the 717 early warning, the what do we call it? The early action review process. Maybe I can just ask Esther for any initial comments before we get into the Q&A.
Thank you very much, Amanda, and hello everybody online. No, I found so far it's been very interesting listening to both presentations from Dalia and from Tyler. And I think Tyler in particular, you came up with a lot of really useful reflections on how this can be practically implemented at country level. And that's what we really want to see in these pandemic fund proposals. At WHO, we've been trying to measure some of these indicators since around 2019, when we had our 13th global program of work. And some of the challenges that we've had in terms of measuring them, and this is in measuring events that come to us, that are reported to us from countries through the IHR mechanism, is really around defining what those variables are and how you actually look at when an event started and how an event is actually notified, and thinking about what the geographical remit of that. And I think there's many practical steps in that will need to be reflected on by those at country level. I think it will be a really interesting area of work that has already started in lots of countries. And I think through using the pandemic fund proposal, it'll be great to see it move forward. I think that's all from me from now.
Thanks so much, Esther. So maybe that opens up the first question, because the Alliance has worked with a number of countries to really get that definition, both geographically and around the definition. So Tyler, I think one of the first questions that popped up was, is this only for confirmed outbreaks, or can you use 717 in other ways?
Yeah, I think it's a great question. I mean, 717 has proven to be a highly flexible tool. So I think the value of it is it allows you to implement it frequently and early in any public health event. So even if it's not yet a fully confirmed outbreak, you can still start to assess detection systems using these approaches. So I think the idea behind the tool is that that the flexibility allows us to implement it to provide value in a wide range of contexts. And those contexts can vary based on the nature of the event itself, based on the disease, based on the sociocultural and geographic context. But 717 has proven to be flexible enough to add value across a wide range of those different scopes. And so, you know, and I think it's also worth noting that as we continue to roll this out, we're also have an operational research agenda as well. So we continue to test our assumptions and the sort of adaptations of 717 to further refine the tools and the approaches and share that knowledge with partnering countries, so that we can all continue to learn together as we continue to scale this and use it to demonstrate impact.
Thanks so much for that answer, Tyler. So just to confirm, though, those 7 actions within the response 7 are part of verifying an outbreak. So 717 starts from that first notification before you have the lab results, before you verified that outbreak. So 717 very much starts as an event, and those 7 actions at the end are really around whether the outbreak is a verified outbreak or not. So the answer there is yes, 717 is for every event and part of the process for verification. Maybe we'll stay along that line around the 717 questions before we get to the PF question. So there's a question there, Dalia. I know you've been using this in EMRA in your previous role, but there's some questions around the use of 717 in event-based surveillance systems and as a decentralization at community level. Maybe I can ask you to just reflect on where 717 sits and its utility in event-based surveillance. Oh, yeah.
Mute. I was on
There
mute.
you go. There you go.
Thank you, Amanda. My simple answer would be is that it can really be used in any type of surveillance in the country. We know that countries mostly they rely on the indicator-based surveillance, but also or in line with the international health regulations, we've been really advocating that the indicator-based surveillance alone is not enough, and therefore this really has to be complemented by different type of surveillance, but also it depends on the country structure, it depends on the sources of information that can be used, it depends on the context of the country, and therefore we see early warning systems stands alone sometimes in the conflict-related countries. Community-based surveillance, it works in some places where the government is somehow not able to send or to have a fully organized surveillance system, and therefore the reliance would be on the community-related detection and information. And of course, the fully organized event-based surveillance, but also the tool that has been put in place by WHO and has been used only to do the screening of media and social media to collect some information, which is sort of event-based surveillance, which is the open intelligence, epidemic open intelligence.
Yes.
So there are the point here is that it really, regardless of the type of surveillance you have inside the country, you can use the 717. And maybe just to reflect a little bit on the fact that we've been receiving information that, oh, the information that usually coming out might not be realistic. Sometimes you have an overestimation of the capacity of the country or lower estimation of the actual strength in the country. It doesn't work like this. I think we really need to be realistic in doing this kind of evaluation. You really need to follow the steps as they are. But the most important part is you really need to bring all the relevant stakeholders around the table when you are doing this exercise. The beauty of having the different sectors is that everybody can complement the missing pieces of information. And this is how you craft the whole story to get to know exactly what are your gaps and what are your strengths. And I think this, perhaps, Amanda, sorry to take longer, but it really tackles on the gap and the challenge that the whole world has been facing. I mean, we keep talking about pandemic and other threats, but we have some root causes of problems. I mean, yes, pandemic fund is here to provide financial support, but we want sectors to work together. And the limitations of any tool can be there, whether it's the 717 or the SPAR or the GEE, if you will not be able to bring sectors together, if you will not be able to be very much realistic of your situation, and if you'll not be able to be open enough to pinpoint what are your gaps, what exactly that you need to do in order to improve and to move from this point to that point. And this is the kind of discussion that 717 can have, in addition to the other tools as well.
Thank you so much, Dalia. And this has really been the thing that's impressed me about this. I think 717, we get a bit focused on the numbers and the definition. How do we report the numbers? But the real value add, and what I've seen from countries, is that conversation about how did our system perform? How did we find the outbreak? Could we have done it faster? How long did it take us to tell our surveillance colleagues or our lab colleagues? How quickly did we get our response going? And really interesting, I come from a community health worker perspective, you know, that comprehensive response. Sometimes our epidemiologists get out there and do the investigation. They leave the risk communication team behind. So 717 really allows us to have that conversation across sectors, make sure that we're moving quickly and finding where our system's not performing. And that's why I was so impressed that the Pandemic Fund picked this up as an impact indicator, really because it shows us the improved performance of our investments, not just that we've ticked boxes of activities. So maybe we can get a little bit more into how Pandemic Fund envisaged this as a results impact indicator rather than just how we go through the process. So there's a couple of questions here, Dalia. I apologize for putting you on the spot, but there's a few questions here around criteria for winning proposals, who can apply. So let me just try to capture those. I think there's a question around, can privately owned organizations be part of the process officially? And what are the criteria for winning proposals and eligibility for the Pandemic Fund?
Okay, so I'll try to put quick answers, but also I will put the link for the Pandemic Fund on the chat so everybody can have a look into it. So it was basically put in a place to support the low and middle income countries to build their capacities for pandemic prevention, preparedness, and response. The whole idea is that we develop or we establish kind of sustainable financing mechanism. At the moment, there are a number of contributors, financial contributors to the fund. The initial ceiling for the first round was around 330 million, but for the second fund, it's about $500 million. Which is really, if you look into it, it's a drop in the ocean of needs of countries. When the COVID hit, I think there is a big realization of the fact that countries have been running around to do so many different evaluations, whether it's the SPAR, which is annual, or the GEE, 717, interactions after actions, and so on and so forth. And the majority of the countries, they managed to come out with their own plans for health security. But those plans, basically, I mean, if you look into them now, and if you compare them with when they were developed like a few years back, there is no much progress. which really highlighted different challenges. One of them is related to the overall positioning of this area in a higher level in the government, where we really need to elevate the understanding of health security. It's not only with the health. Yes, health sector, they play a major role related to it, but it really has to engage the other sectors and to take an upper hand to facilitate its implementation. The second one was related to the finance. And if we look into the IHR, we know that domestic financing for health security or IHR implementation has to be identified and itemized. And this is not there. We're not there yet. I think there is still a long way to achieve this. But in addition to that, how the countries are able to mobilize resources, external resources using different mechanisms. So the pandemic fund was established to put a point in the external resources to be mobilized to countries. There are, as I mentioned at the beginning, there are priority areas that we're focusing on. Okay, so the idea of how to make sure that your proposal is successful. It really depends on your ability to craft the story. Whether you will be able to make your proposal appealing, that we exactly understand what are the risks, we exactly are able to identify what are our challenges, and we're exactly putting a very concrete plan of implementation to move forward in building the capacities. Making sure that you're bringing all the sectors is critical. Making sure that you're bringing different implementing entities is critical, and not only the 13 identified implementing entities, any other organization that can be considered as a third party on the ground that will help you in the implementation. And this really includes other organizations, civil society organizations. The more you bring partners, it really shows how you are able to spread your arms and make sure that you have the convening power within the government to bring those bodies on board. This can be used as a recipe for your success. And maybe last word on that is, we know that the majority of the countries, which are the low and middle income countries that are eligible for this kind of funding, they might not have the domestic resources to put for the pandemic fund, but they still can show sort of investment in terms of the in-kind contribution that they can provide, existing infrastructure that they have, existing human resources that they can rely on, but also how the other partners will be able to bring additional funding. Organizations like WHO or UNICEF, they might not be able to put additional fund, but they can use their own expertise and experience, and that can need to be converted in a dollar value. Others can bring some finance. So we look into the leverage value, which means how much money you will be able to bring in addition to what you are asking, in order to bring a full investment for the pandemic prevention and preparedness and response. So please do apply. The deadline is 17th of May. You still have very short time. But just back to the point that we're discussing, Amanda, and I'm grateful for putting me on this webinar. 717 is not only help you to measure your impact, it will help you to measure your progress during the different points of time. The duration of the project is maximum 3 years, which means that you can run as much as possible 717 reviews, where you can get points of data, and this will help you to draw the trend and how much you're able to improve your capacity. So we look into utilizing it for generating outputs and for generating improved outcomes, but also for the overall impact, how this really helped you in addition to the other tools in improving your capacities as you move forward. I hope I answered the questions.
No, that was great, Dalia. Thank you so much. And obviously, you know, Tyler emphasized this at the beginning, and I think Dalia, you also mentioned it. 717 is one tool of the IHR M&E framework. WHO had gone through in detail a lot of the other tools, including how to use the JEE and the SPA. After action reviews are extremely important as well. And so using all of that data and synthesizing that to build it into your plan. But we know 717 is a little bit of a newer approach, and so we wanted to make sure that we provide that extra technical expertise. But it's important that it uses all, you know, you use the whole IHR M&E framework. And so that leads me to maybe our last question, Tyler, before we wrap up. There's a few questions around One Health and other sectors. Maybe you could walk us through how you've been using 717 across the sectors, in particular One Health events.
Yeah, exactly. So this is an exciting area. One Health it remains a critical part of the 717 use opportunities. We have started to see countries that have been implementing 717 for animal health events and for zoonotic spillover from animal to human, and we're also using 717 when we see outbreaks and identifying bottlenecks related to One Health coordination and management. And so we've seen, just as in other areas where the flexibility of the tool allows us to apply 717 across different types of outbreaks, that extends into our One Health work as well. This is also another area where we're continuing to try to push the bounds of 717, being as it is fairly new, and we have some opportunities around operational research to continue to expand and test the ability of 717 to be a useful tool that can provide system strengthening through a One Health perspective as well. So that's sort of a general response. Amanda, anything you want to add on that?
Perhaps, Amanda, just sorry for that, because I mean, just to your point, as related to the 717 and how it's part of the overall IHR monitoring and evaluation, and just to highlight also to the colleagues that please do use the interaction and after action reviews or early action reviews which are the tools developed by WHO. I think the whole idea is that you utilize the different tools because it will help you to complement the picture, but also to show somehow, if you want, similarity when it comes to the outcomes or the findings that you are coming out with, regardless of the type of the tool that you're using. Whether interaction, after action, or the 717, the beauty of them is that they give you the qualitative and quantitative pieces of information, but it shows you the change over time. Unlike the SPAR or the GEE, it will be almost impossible to see a change in the scores during or over a short period of time, and particularly the SPAR, because yes, we know that you are conducting it on an annual basis, but when we are looking into the data for the last 10 years, we're actually in a very stagnant approach or a stagnant level. There is absolutely no significant increase in countries when it comes to these capacities. So you still need to use the IHR, SPAR, and GEE because the approach and the story is different, but the other tools will help you to collect information and show progress over a shorter period of time. Thank you.
Excellent. Well, thank you so much, Dalia, and to all of our panelists. I also just want to point out, I see a lot of information in the chat. Several of the countries that have really piloted and tested 717. I want to give Dr. Mukumbi a shout out. I see him in the chat. He really has been our champion in testing and working with 717. He's actually the chair of the 717 Alliance. And so one of the key things here has been countries sharing how they're using the approach and how they're using all of the tools to really inform planning. So I encourage you to check out the 717 Alliance website. One of the key things here is the community of practice and sharing information. And so the team will be able to follow up more specific questions, especially there was some about who gets trained or where the training is available. All of that information is on the website, or you can email the team. Obviously, WHO and the team there also available, especially in country, as different partners are leading on the pandemic fund. So we're at time. I just want to be respectful to everyone's time. Thank you so much. We'll share the webinar and the presentations as well as the links to further information. Please reach out if the Alliance and the team can be of any support. But thank you to all of our panelists and everyone that joined us today.